Hi, this is Tom Heston, editor of the Internet Medical Journal, and today I'm going to go over the evidence for vitamin D and your health. I think after we go through this presentation, you'll find that vitamin D is critically important to your good health and that you'll want to know that your vitamin D levels are sufficient to maintain a healthy life and good living. Okay, the first study that we're going to look at is vitamin D and melanoma. And we'll see that in this study, the authors found that patients with thicker tumors and poor prognosis had lower vitamin D levels in their blood. This study was not yet validated, but it's interesting and evidence of further research in the area needed before we jump on the bandwagon with everything. A second study that's recently out, again from January of 2013, looked at vitamin D in autism. And they found that children with lower vitamin D levels were more likely to have autism. Again, they didn't find that this was a causal relationship. However, they did conclude that vitamin D deficiency during pregnancy and childhood is widespread and it's a growing epidemic. A common theme from these research studies that we're looking at is that sunlight exposure does not seem to be adequate to maintain adequate vitamin D levels, and that more and more experts are recommending supplementation either through milk or through vitamin tablets. Now here's another study looking at vitamin D in a lot of different medical conditions, and what these authors concluded when they reviewed the literature, they found that vitamin D was associated with autoimmune diseases, calcium metabolism, some cancers, diabetes, mellitus type 2 infection, and heart disease. And they conclude again that the recommendation is to improve the general vitamin D status in children and adults by means of healthy sunlight exposure, consumption of foods containing vitamin D, and supplementation. Another study looked at vitamin D status and hypercholesterolemia in a Spanish population. And these authors concluded that those with higher levels of cholesterol had lower levels of vitamin D. That's a negative correlation. So low vitamin D was more likely to be seen in people with high cholesterol. Again, they found an association, not a causal link, but an association, and more research is recommended. Here's another study from the Asian Pacific Journal of Cancer Prevention, done in 2014. And these authors found that severe vitamin D deficiency causes a threefold increase in the risk of breast cancer, although moderate and mild deficiency was not associated with that risk. Okay, here's another study from the International Journal of Health Sciences in November 2013. It looked at vitamin D deficiency and thyroid disease. And these authors found that patients with low thyroid, hypothyroidism, suffered from low vitamin D levels and low calcium levels. The degree of the low vitamin D and low calcium was associated with the degree of hypothyroidism, and they recommended screening for vitamin D deficiency and serum calcium levels for all patients with hypothyroidism. Now finally, let's look at this study looking at children with mental disorders and vitamin D levels, published in July 2013. Now these authors did not find a statistically significant relationship that they thought was due to the low numbers in their research study. However, they did find that the overall mean vitamin D level in their study was in the range of insufficiency, that is 27.59, compared to a level of 32 nanograms per milliliter in the general pediatric population. Again, this is a theory, but it's suggestive again that vitamin D may be related to mental health and that low vitamin D levels may be associated with poor mental health. In summary, I think we conclude that vitamin D levels are very important in order to maintain good health, and that it's worthwhile knowing that you have adequate vitamin D levels in your system. Now, new from the Internet Medical Journal is the Primary Care Medicine Journal Club, and we are at pcmjc.com. Our latest Journal Club article is the hospital-dependent patient, which was recently published in the New England Journal of Medicine. And you can find the questions and the link to the article on pcmjc.com. And also follow us on Twitter. And we are going to be discussing the article through the hashtag PCMJC. And you can follow us and discuss interesting articles from the New England Journal of Medicine, JAMA, the Lancet, and more. And we'll have a lively, interactive discussion about important health topics through that medium. Thank you very much. Again, this is Tom Heston. Bye for now.